Hello. Today, I'm going to talk about ultrasound guided intervention. Ultrasound intervention includes two primary skills: visualizing the target organ and controlling the needle. The goal of this video is to help you learn the needle control technique, specifically how to control the needle tip. I will use fruit jelly as a practice model. It's an excellent tool that is inexpensive and easily available anywhere. We'll use various types of fruit under ultrasound, like cherries, oranges, pineapples, and peaches. These make excellent practice targets. We also use a long needle with a syringe for control practice. Key points for needle control. First, proper positioning of the doctor, patient, ultrasound probe, and injection needle is crucial. Second, don't rely solely on the monitor. Many beginners continue watching the video monitor, but you need to focus on the injection site. I'll explain these details further. The first key point: the positioning of the monitor, the subject, and the doctor. This is an example of incorrect positioning of the doctor, patient, and monitor. The patient and video monitor are positioned separately, allowing you to watch the monitor and probe from different angles. Why is incorrect positioning a problem for needle control? Poor positioning makes it challenging to detect the needle tip on the ultrasound. In this setup, even if you try to align the direction of the probe and needle, your line of sight is perpendicular to the plane of the probe. Once you lose sight of the needle tip on the monitor, it's difficult to regain control. Let's take a look at an actual practice session. The probe and target are positioned in a direction different from the screen. The practitioner is moving the probe and needle tip to align them, but because the line of sight is perpendicular to the probe, positioning the needle tip on the plane of the probe is very challenging, as it is difficult to judge the distance. So, what is the optimal positioning? The best way to position yourself is by aligning the target between the examiner and the monitor. Next, place the ultrasound probe parallel to your visual line to match the ultrasound plane with your line of sight. On this line, insert the needle by aligning it with the visual line, probe plane, and needle direction, making the needle tip easier to detect. Let's practice. Position the target between the monitor and the examiner. Place the ultrasound probe parallel to the visual line. Make small adjustments to the probe to bring the target into view on the ultrasound. Then insert the needle in the same direction. In this way, by inserting the needle along the straight line where the line of sight and the probe are aligned, even slight adjustments will allow the needle to appear on the ultrasound monitor. What should you do if you lose sight of the needle tip? If you lose sight of the needle tip, don't move the needle or probe immediately. Instead, first check the injection site and needle alignment. Align the direction of your line of sight with the needle. Then adjust your visual line and probe position to match. You should then locate the needle tip on the monitor and can proceed by moving the probe and needle together slowly toward the target. Let me explain using an actual model. As you can see, when the direction of the needle and the probe differ, the needle often doesn't appear on the monitor. In this case, first, carefully observe the insertion site. Check the direction of the needle. Then adjust your line of sight to align with the direction of the needle. Next, tilt the probe in this direction to match the needle's angle. When you check the monitor, the needle tip will appear. To keep the needle tip visible, slowly move the probe and needle together, guiding the needle tip towards the target. The second key point is not to focus too much on the ultrasound monitor when the needle tip is not visible on the screen, that is, when it is in the blind zone. The area where the needle passes can be broadly divided into two: the US zone, where the ultrasound beam reaches, and the blind zone, where the ultrasound beam does not reach. First, when inserting the needle, focus on the insertion point rather than the monitor. Align the direction of the needle tip, your line of sight, and the probe in a straight line, and insert the needle along this line. Most people are already aware of this. Immediately after insertion, the needle tip is still in the blind zone, where the ultrasound beam does not reach. At this stage, it is important to focus on the insertion site instead of the monitor, and to concentrate on aligning the needle tip, your line of sight, and the probe in a straight line. Advance the needle further, and once you believe it has reached the area under the ultrasound beam, check the monitor. Now, let's demonstrate using an actual model. We will target the tip of the sprue and guide the needle tip towards it. When inserting the needle, focus on the insertion site and align the needle tip, probe, and your line of sight. Do not look at the monitor. Advance the needle slightly. At this point, the needle tip has not yet reached under the probe. Even here, do not look at the monitor. Focus on maintaining the alignment of the probe, needle tip, and your line of sight. Advance the needle further until it reaches the area under the probe, and at this point, check the ultrasound monitor for the first time. You will be able to see the needle tip on the monitor with minimal deviation. From here, slowly advance the needle towards the target while making small adjustments to the probe to keep the needle tip visible on the monitor. This is an important point, so I will repeat it. When inserting the needle, do not look at the monitor, focus on the insertion site. After insertion, continue focusing on the insertion site until the needle reaches under the probe. Only when the needle tip is under the probe should you check the ultrasound monitor for the first time. From that point, advance the needle towards the target while watching the monitor. That's all for this lecture on needle tip control. Remember to align the visual line, probe plane, and needle direction. Until the needle tip comes under the ultrasound beam, avoid looking at the monitor. Focus on aligning the probe, your line of sight, and the needle tip at the insertion site. Thank you for watching. I'll continue to share valuable techniques on this channel. Please subscribe if you're interested. Thank you.